Thank you, Darren. Yeah, we're going to switch gears a little bit here. We're going to talk about return to play after ACL construction. Kevin asked me to discuss what I've learned from both physical therapists and patients over the past 30 years. It's supposedly my secrets, but I assume most of you have already thought of a lot of what about where to discuss. Those are my disclosures, nothing directly involving this particular discussion. So to start off, in addition to what we learn as residents, surgical orthopedic residents, it's also important, I believe, to pay close attention to what our physical therapists and particularly our patients tell us over the course of our practice. Valuable information that doesn't necessarily get shared with orthopedic residents early on. One of the key things to remember, is important to remember, is that whatever post-op rehabilitation program is being utilized, it's the one that both you and the physical therapist created together and have bought in together. The other thing is that when the patient goes off to undergo physical therapy at a distance away from your direct supervision, and you're not familiar with that particular area or therapist, it's important you personally speak to the therapist and make sure that they are following your specific rehabilitation program, not only on the initial visit with the physical therapist, but periodically throughout the rehabilitation program, that the therapist doesn't go wandering off what you would define as a fairly strict protocol. One of the first things I learned about a physical therapist, and this is somewhat tongue-in-cheek, but I've learned it actually as some true factual basis to it, and that is try and avoid surgery on females with red hair or freckles. I thought this was somewhat comical when my therapist told me this, but true to fact, it seems for whatever reason, these types of patients develop problems with recurrent laxity, less tolerance for pain, and loss of motion. The second thing from that I've learned from physical therapists, that the actual hands-on time that they spend with the therapist has a huge effect on how that patient perceives the value of the time and money they spend with physical therapy. So that's an important amount of time or important consideration to focus on when you're talking about valued time spent with the physical therapist. I think Lou McIntyre talked about this. I like to expound on it a little bit more, particularly those of us that deal as or in the role of a team physician. And that specifically is a difference between physical readiness, or how tight the knee is, or what the motion is, what the quad strength is, and psychological readiness when it comes to actual return to play issues. Psychological readiness, what does that mean? That there are psychological factors that come into play after injury and surgery that affect the outcome. We all have heard about fear of re-injury and items such like that, but we need to recognize that in addition to that, there are significant factors that affect the athlete's willingness to return to play beyond fear of injury. And these are basically red flags that we get from a physical therapist. A recent example of that is Andrew Luck, and this is a direct quote from a news article. For the past 4 years or so, I've been in the cycle of injury, pain, rehab, and injury, pain, rehab, and it's been increasingly unrelenting, both in season and off season. I felt I was stuck in it. The only way to get out of it was not to play football anymore. That is, in my opinion, a classic example of what the psychological effects of injury have on athletes, even if they're not high profile. So we're talking about red flags that the physical therapist can provide for you during the progression of rehabilitation. This is when, for example, a rehabilitation program following an ACL reconstruction starts off good, but early on the physical therapist calls you with concerns and progress gets derailed. The therapist calls you and says, quote, I don't know what to do, or it tells you that the patient says, quote, I don't want to do that exercise because I think it makes things worse. Or the patient says, I'll do twice as many of those particular exercises and I'll get better in half the time. So during the post-op rehab program, you really need to be in frequent contact with the physical therapist. Because again, during the course of the rehabilitation program, the therapist may express to you that this patient or athlete has an unreasonable fear of re-injury, that they continue to deny the severity of their injury, that they've expressed just generalized more impatience, irritability, have mood swings, withdrawal from friends and teammates, extreme guilt about leading the team down, dwelling on minor physical complaints, obsession with return to play questions. What have I learned from my patients over the last 30 years? Number one, the more time you spend explaining the surgical and post-op rehabilitation program, the better prepared the patients are. The better prepared the patients are, the less frustrated they become post-operatively. The less frustrated they become post-operatively, the happier you will be. So what does that mean? That means take time to explain away unrealistic expectations preoperatively. And that's certainly available, these unrealistic expectations on the internet. Try and match up patients in physical therapy with the same post-op rehabilitation program. Try and match up your 3-month out ACL patients with your 3-week out ACL patients. What I've learned from my patients also, the patient's perception of the skills and talents of the physical therapist generally reflect back on what they feel as you as a surgeon. So try and not only choose the personalized rehab program that suits the particular patient's situation, but also, if possible, choose a physical therapist that best fits the psyche of that particular patient. It's important that the patient clearly feel that there's a frequent communication between you and the physical therapist. Don't hesitate to speak to the therapist in front of the patient. So the take-home messages are one, listen to your physical therapist and patients of what they're trying to tell you. There's a difference between physical and psychological readiness. Both are important. Take the time preoperatively to personally explain to patients realistically what to expect postoperatively. And if possible, try and match the personalities between the therapist and your patients. Try and pair up post-op patients with the same rehab program, and if possible, take time to speak to the therapist directly in front of the patient. Communication is key. Thank you for your attention.